Magandang araw and welcome to The Doctor is In. I'm Dr. Freddie Gomez. This program is for you. Think of this as your virtual doctor's appointment during this time of COVID-19. So please send in your questions about COVID-19 and we will do our best to answer them. So for today's topic, we will be discussing family planning and population control during this pandemic time. Because as we all know, according to the UN Population Fund, the number of unintended pregnancies could hit 7 million due to the disruption of reproductive health services during this pandemic. This could be a problem, especially in a country like the Philippines, where one out of every three births is unplanned. Considering that the quarantine is far from over, what are the best ways to manage and prevent unwanted pregnancies during this period? So, to help me answer that, we are joined by Dr. Juan Antonio Perez III. He's the Executive Director of the Commission on Population and Development. Welcome to the program and thank you for joining us, Doc GP.
I'm happy to join you, Doc Freddie.
Now,
And
Doctor, the term family planning is not new. A lot of our viewers are very familiar with this. But how is family planning very important, especially in a time na ngayon during pandemic?
well, family planning has been practiced in the Philippines, more particularly since the 60s and 70s. Over time, people have been using a mix of traditional methods and modern family planning methods. Currently, about 95% of modern methods, or which are a combination of artificial and natural methods of family planning. And the most modern method that's most common is the pill, the combined oral contraceptive. And this pill is being used by around 2 million women uh, currently, which are covered by the government program that's implemented by local governments. So the problem in the pandemic situation is that with the quarantine being imposed, uh, women who need family planning pills, for example, may not be able to go to the health centers. They will have difficulty in getting public transport to get the supplies that they usually get every month. So the disruption in this program, because people cannot go to the health center or barangay health station for that, could affect 2 million women, and therefore thereby increase the number of unplanned pregnancies in the country. And I guess UNFPA is projecting it worldwide that throughout the period of the pandemic worldwide, that would be 7 million.
Mhm. Now let's answer some of the social media questions. Marami po nagtatanong. We have one from Garia. Ang tanong niya is, how can families access contraceptives during the pandemic?
Yeah, so what we're doing right now is, with limited access by the people to health centers and barangay health stations, we have sent out a memo, directive to all our regional offices to support local governments to deliver contraceptives directly to the homes of the women who have been enrolled in the family planning program, particularly for pills. So since March and April, our local government partners, particularly barangay health workers, barangay population volunteers, have been going to the houses of the women who are enrolled in the program and giving them 3 months supply. So therefore, for 3 months, they are assured of their supply. But now with the quarantine being extended, for example, here in NCR, they may have to do another round of providing another 3 month supply. to the women who cannot go out of their homes. On the side of DOH continues to procure the family planning commodities, transfers them to POPCOM, which delivers them to the local government units. And then it's in the hands of the local government units to bring it to the homes of women who need those. And we're using pills and condoms to be distributed. Uh, the problem might be that if you're using an injectable, you may really have to go out of your way to go to a barangay health station or health center where you can be injected. We also have available implants that can also be provided at the local health center. Um, During that procedure, there will have to be adequate protection for the woman as well as the doctor or nurse or midwife providing the service. So that makes it a bit more complex, but with proper scheduling, everyone we hope can be served so we can avoid yung unplanned pregnancies.
Okay, we are definitely looking forward to that. At least they have access to several options of family planning methods. Now we have another question from Maricel. Where can we learn about family planning? May online materials po ba na pwedeng ma-access kahit nasa bahay lang?
Yes, we have a Facebook hashtag mag-usap tayo sa FP or usap tayo sa family planning. You can access that. We also have what we call helplines in NCR and in all the regional centers. They just call the number and there will be someone who will assist the person. Our top of message, of course, is family planning. But we know women also call about teenage pregnancy, adolescent sexuality. There might also be questions on gender-based violence because we know that domestic violence might be increasing during this period. And we also respond to questions on COVID itself. No, in family planning, in particular, if you're not able to access, go out of your home, we can link you up to the local health services, and we can be the ones to sort of facilitate the delivery to your home or find a way for the local health personnel to reach out to you.
Okay. Thank you very much, Dr. Perez, for joining us. Your insights have definitely been very helpful and showing our viewers the options they have for family planning. After the break, we will be continuing to talk about family planning plus other methods of contraception. So stay tuned. The doctor is in. We'll be right back.
Amid the darkness, look on the bright side. Frontline medical workers are at bigger risk of catching COVID-19. But this nursing assistant at a hospital in Taguig City won't let the disease get him down. And Nico Torreon wants to share only good vibes on social media. This was also Torreon's way to let his family know he's alive and kicking. He's also appealing to everyone to follow the quarantine guidelines.
Magtulungan tayong lahat at saka sana sumunod kayo sa kung anong batas ang pinapatupad sa atin to, sa family natin, sa kalusugan natin.
In sickness and in health, this married couple was released from a Mandaluyong hospital after recovering from the coronavirus. And what a beautiful send-off they got from the doctors and nurses who took good care of them. Always confidently beautiful with a heart, 2015 Miss Universe Pia Wurtzbach is doing her share. Wurtzbach donated nearly 17,000 face masks for medical frontliners in Metro Manila.
I want to encourage everyone to do what they can. I mean, a little goes a long way. Kahit maliliit na donations lang yan, when I add it up, I can buy thousands of masks.
The Quezon City District 3 Fire Brigade water salutes our medical frontliners. It's a tradition usually reserved for firemen. A caravan of more than a dozen fire trucks drove around hospitals in Quezon City to applaud the medical workers for their courageous work. They are our brave, modern-day heroes who are risking their lives to save others. I'm Ria Tanwat Cotrillo, CNN Philippines.
Welcome to The Doctor is In. I'm Dr. Freddie Gomez, and while you're staying safe at home, we hope that we could provide you with the medical knowledge that you need. So, today we're talking about family planning and the challenges of unplanned pregnancies during this time of the pandemic. So, right now, let's welcome to the show obstetrician and gynecologist Dr. Airen Sigue to answer further questions that we have with regards to family planning. Welcome to the show, Dr. Sigue.
Hello, good afternoon to you, Dr. Gomez, and to all the viewers of CNN Philippines. Thank you for inviting me.
Now, the Commission on Population says that nearly half of the women of childbearing age here in the Philippines have limited or maybe no access to contraceptives due to the pandemic. Are there other options that they may have in case they do not have access to contraceptions?
Actually, there are different types of contraception that they can access. That's the problem during this pandemic. It's difficult to buy oral contraceptive pills in the pharmacy, and also to go to the doctor's clinic for their regular injection of progesterone if they're using it, and to get condoms, and to get the proper advice. But there are remedies for this situation, ano. Pwede silang tumawag sa mga clinics or hospitals via telemedicine to talk to their doctor so that they will be properly advised. Kailangan malaman kung kailan sila huling nagkaroon ng menstrual period at kung kailan yung kanilang sexual contact with their partner or with their husband.
Okay, now, Dr. Sige, many may not be aware that there are inherent risks of unplanned pregnancies. Could you discuss this a little bit more?
Yes. Actually, with or without pandemic, if the pregnancy is unplanned, it has inherent risk for that. Actually, according to the press conference of Health Undersecretary Dr. Vergeri, she mentioned that during this pandemic, it is important that the pregnancy is planned so that the family can address the needs of the pregnant woman and the child that is about to become a member of the family. Because aside from the health issues, may issues din tayo sa access to food, financial issues of the family, and of course the stress of being pregnant in a pandemic. With unplanned pregnancy, of course, hindi na napagplanuhan, hindi na na-examine maigi yung mommy as regards sa kanyang history and physical exam, kung siya ba ay prepared magbuntis ulit, ang kanya bang blood pressure, body weight, dietary intake, ang kanyang exercise, lifestyle, yun ba ay naaayon or preparado ba siya sa kanyang pagbubuntis. And also, during the pre-pregnancy planning, kung hindi ma-address yung evaluation ng pregnant woman, like also are they smoking, are they into alcoholism, or are they using mga drugs, yung sa mga usually young women tong nagkakaroon ng unplanned pregnancy, and most of them are using tobacco or into smoking. So dapat talaga ma-examine sila. Minsan pa meron pa silang mga sexually transmitted infection. So it's difficult kung sila ay magkakaroon ng unplanned pregnancies.
Okay, very well said. Now let's take a look at the questions that we have online. We have a question from Hannah. What should a woman do if she learns of a surprise pregnancy?
Actually, yung tinatawag nating surprise pregnancy, um, dapat nga malaman ng ating mga women or female patients na if you are in the reproductive age group of 20 to 35 years old, if you have unprotected sexual contact, there's a possibility that you will really get pregnant. So parang dapat inaabangan mo na yon kung unprotected yung sexual contact mo. So just in case they did a home pregnancy test and it turned out positive, the soonest time they can contact their doctor, the better. The doctor can be their family doctor or an OB gynecologist. Most of the clinics and the hospitals have a telemedicine system right now, so it should not be a problem. They should be very active in addressing their health concerns now that they've discovered that they are actually pregnant.
Okay, so at least a lot of people now know that there are a lot of options to do in case they do have a surprise pregnancy. We have to pause for a quick break, but when we return, we will discuss how to stay healthy during your pregnancy. So please stay tuned. The doctor is in on CNN Philippines. We'll be right back. I'm Dr. Freddie Gomez, and welcome to The Doctor is In. We hope that while you're staying safe at home, we can provide you with the medical advice that you need. So kanina pinag-usapan natin ang mga risks ng unplanned pregnancy. Ngayon, let's talk about how to cope with the situation and plan for a healthy pregnancy. So we are joined by Dr. Irene Sigue, who is an obstetrician and gynecologist. Dr. Sigue, when it comes to the diet of someone who is pregnant, what is the ideal diet? Because alam natin na a pregnancy may involve cravings. Okay lang ba na to give in to all of those cravings, to eat whatever the body desires?
Yeah. Actually, tulad ng sinasabi natin, yung pagbubuntis, dapat yung preparation yan, hindi lang doon sa time na nabuntis siya. Even 1 to 3 months prior to pregnancy, dapat may preparation ang a woman who's planning to get pregnant. For example, she should be living a healthy lifestyle. She should be taking adequate balanced diet, lalo na itong folic acid, because this is very important in preventing neural tube defects, yung abnormality sa brain ng baby, no? Kailangan nag-exercise siya and she's not smoking, she's not drinking alcohol, she's drinking adequate water every day, and she should have the proper immunization prior to even thinking of pregnancy. Now, dun sa diet, that's why it's very important na the moment you know that you are pregnant, you better consult your doctor because in your initial visit, lahat ng vital signs mo will be taken. No? For example, your body weight. So your doctor will compute your body mass index. There's a certain normal range for pregnant women, which is 18.5 to 24.5. So below that is your BMI is below that. So at risk ka naman magkaroon ng mga babies na yung tinatawag nating low birth weight babies or pwedeng maging growth restricted. Ngayon, kung masyado namang on the obese side yung pasyente, pwede naman na magkaroon ng mga komplikasyon na diabetes, hypertension, cardiac disease. So, ang preparation for a healthy pregnancy really starts 1 to 3 months prior to getting pregnant. In terms of nutrition, of course, balanced diet, yung although we give supplements to the pregnant woman, nandun pa din yung dapat yung carbohydrates mo should be 60% of your diet. The fat should be at least 25% and the protein is 15%. When you go to your prenatal checkup, your doctor will determine your BMI and then based on that, merong mga specific required weight gain during pregnancy. If you're normal, it should be 1 pound per week. And yung total weight gain mo during pregnancy, i-advise din depende nga dun sa pre-pregnancy weight ng mommy.
Okay. Now, during a pregnancy, during a pandemic, it can definitely be stressful, Dr. Sige, especially if the pregnancy is unplanned. So during this time na pwedeng high stress na si mommy, how important is self-care during times of stress?
Nako, napaka-importante ngayon, especially we are in a pandemic, ano? Kasi whether you're pregnant or not, of course, we should observe all the precautionary measures to avoid getting COVID-19. Ano? As usual, the wearing of mask properly, no? You cover the nose and the mouth, hand washing, do not touch your face, social distancing, go out of your house only when necessary, especially sa pregnant women. And that's in addition to the usual prenatal care, no, sa pregnant women. Yun nga, maintaining the adequate food intake, hangga't maaari yung wag masyadong maalat tsaka masyadong matatamis, kasi maalat pwedeng mag-cause ng increase in your blood pressure, especially if you have a family history of hypertension, and if you have a family history of diabetes naman, kung mahilig ka masyado sa cakes, pasta, the pregnancy itself can cause the gestational diabetes. So if you'll be not conscious of your food intake, pwedeng ma-aggravate or magkaroon ka na talaga ng gestational diabetes. But of course, very
Okay,
important
now
din
it's
yung
time to answer some of the.
yung
Yes, go
mental
ahead,
health
doctor.
din ng
You can finish off what
very
you were saying.
important din yung mental health ng pregnant woman, ano. As they said, it's okay not to be okay. Paminsan-minsan talagang feeling mo nakakatakot talaga, no? But it's important. It's even should not be called social distancing, no? Dapat physical distancing lang. Dapat you should be in in contact with your relatives, with your friends, para yung mental health mo, especially pregnant women, ano. And also yung proper intake of the multivitamins, kasi as a pregnant woman, syempre decrease yung lung capacity and yung immune response ng body. So mas dapat talaga she keeps her body healthy. That's para mapalayo siya dun.
Okay, I think we lost Dr. Sigue there for a while, but she was mentioning how important it is for a pregnant mother to be physically fit. Don't forget to exercise and mentally fit as well. So she was talking about how it is that social not contact, social distancing should still be there, but the affirmation from her friends, from her family, in other ways through social media, maybe it still all should be there when someone is pregnant. So it is more or less there, not just for the physical well-being for the mom, but also for the baby to remain healthy. So while we're trying to get Dr. Sigue back, okay, we have Dr. Sigue. Are you okay? So while we're waiting for Dr. Sigue, I'd want to stress also, so even during this time, social distancing pa rin. So for those who may be or might be pregnant during this time, social distancing pa rin, and hand washing is definitely important. So I don't want to add so much things for you to think about, since kung buntis man or kung pregnant man kayo, but you just have to be aware of this new normal that we are in. So we are trying to instill in all of it. So paulit-ulit kami dito, washing of hands, proper washing of hands, soap and water, proper social distancing as well. It may be redundant, marami akong nakikita na medyo hindi naman sa natatamad na para mag-social distancing, pero medyo siguro dahil paulit-ulit nagiging sanay na po tayo at nagiging unaware minsan tayo when we go out, when we need to do our things, na ang social distancing should still be practiced. So, a lot of people are also questioning the importance of this. So, kung bakit ba kailangan pa rin ba mag-social distancing? Ang dami pa, medyo hassle daw kasi mas humahaba lang ang mga linya. You can just look at our neighboring countries around the world, countries that have not been practicing social distancing, and you can see the spikes in the number of cases that they have. So hopefully the Philippines will be able to practice this and still be able to control the COVID-19. Dr. Sigue, are you back with us?
Yes? Sorry for that.
Okay, great. That's okay. That's okay. Now, before we run out of time, let's answer a few questions. Marami pong nagpapadala po ng mga tanong dito, no? We have a question from Brian. I think this is related because kanina na-mention nyo na dapat kasama din ng exercise. Ano? So Brian is asking, what simple physical exercises can you recommend lalo ngayon na hindi pa pwede pumunta sa gym or magpa-coach? So simple physical exercises for someone who is someone who is pregnant.
Actually, exercise is really recommended for pregnant women. Ang problem lang natin ngayon, of course, they cannot go to the gym for now. But then there are exercises that they can do at home. Ang importante lang yung proper attire for the pregnant woman. Dapat maganda yung kanilang footwear. Dapat they should exercise in a maganda yung floor, Kasi yung sense of balance and coordination ng isang pregnant woman is quite difficult. Baka magkaroon siya ng injury, and then yung mga joints kasi ng pregnant woman is medyo flexible masyado. So we have to avoid those injuries. Low impact aerobic exercise, brisk walking, swimming, those can be done. It can be done daily, at least 30 minutes every day or at least 5 times a week. But it's important that they start with a warm up time, 5 minutes, and then until progress siya into the level that they can tolerate. If they have been exercising pre-pregnancy, wag naman nilang they should not try to reach that level nung dati nilang ginagawa. They should not exercise up to exhaustion. Dapat yung tama lang that they can still talk comfortably. Ganon.
Okay, really quick, Dr. Sigue. Until what month can the mom exercise? Until what month of her pregnancy is it safe for her to exercise?
Yeah. Actually, a pregnant woman can exercise at any time during pregnancy. Ang importante lang, wala siya yung mga bawal na simptomas na hindi ka dapat mag-exercise. For example, mataas ang blood pressure niya, she's having a hypogastric pain or naninigas yung tiyan niya, meron siyang spotting or vaginal bleeding, and then she's a diagnosed case of mga placenta previa, bawal po mag-exercise. And then kung diabetic siya, hanggat maaari, wag na rin muna po. And then if she's having symptoms of headache, and of course if she's not feeling well, like she has fever, hopefully wala naman ng fever, cough and colds, kasi when you have those symptoms, rule out COVID-19 tayo sa pag yung symptoms.
Sorry to cut you off, Dr. Sigue, but we're out of time right now. But the gist of it would be that moms can exercise, but ideally they would get the go signal from their doctor and they could consult with them via telemedicine or a lot of the online doctor consultations. So thank you very much, Dr. Airen Sigue, for joining us today. Definitely helpful for our expectant moms on how to stay fit and healthy. And thank you also for all of those who tuned in to The Doctor is In. Sana po ay nasagot namin inyong mga katanungan. Samahan niyo po kami ulit bukas, 3:30 p.m. here on CNN Philippines. I'm Dr. Freddie Gomez. Stay safe, everyone.